Hello, anatomy friends. This is Dr. Alsop, and in this video, we are going to be discussing the joints of the hip as well as the knee. And you will see that we have two learning objectives that are focused on just that. So one learning objective for the hip joint and one learning objective for the knee joint. So let's get right into it. And we have talked about this in a few places now, but the bones that will articulate at the hip joint include the acetabulum, which is of the hip bone, so a relatively deep socket portion on the lateral side of the hip bone. Of note, there is also this is a ball and socket joint, so there is going to be a labrum, or that fibrocartilaginous lip, that is going to sit within and attach to that acetabulum, and that will further improve the fit with the ball portion of the joint, which is the head of the femur, which is an almost complete sphere of bone. In this illustration on the right, it shows that relatively good fit between the bone, especially when comparing it to the fit of the shoulder joint, which is that other main ball and socket joint. Since this is a ball and socket joint, it can do all the actions a synovial joint can do. It can flex and extend, and the degree to which it can do these actions depends a lot on the positioning of the knee joint. It can also abduct and adduct. Abduction range will be larger than the adduction range. And remember, if you can flex, if you can abduct, if you can extend and adduct, a joint can circumduct, which the hip joint certainly can, but not as great a degree as with the shoulder joint. And lastly, the hip joint can medially and laterally rotate, or internal and external rotation. And if you're having a hard time visualizing some of these actions, the videos at this link will help with that. The ligaments of the hip joint are some of the strongest in the body. In fact, the iliofemoral ligament, which is anteriorly placed, as well as relatively superficial, is often referred to as the strongest ligament in the body. And as its name would suggest, it spans between the ilium and the femur and provides just overall protection of the joint. But more specifically, it helps to prevent hyperextension of the joint during standing. There are other ligaments named after what they attach to. I'm not really going to assess on those. In general, the ischiofemoral ligament, which is located posteriorly, is considered the weakest of the three. But in general, there are actually more muscles and their tendons located posteriorly. So the muscles will play a bigger role in the posterior portions of the hip joint region. Let's move distally and start talking about the knee joint. Similar to what we had in the elbow region, the knee joint has three joints in one joint capsule. The true knee joint is formed by the right and left femorotibial joints. And then anteriorly, there's going to be an articulation between the femur and the patella at the femoropatellar joint. Note, the fibula is not involved with the knee joint, other than being an attachment site for muscles and ligaments. The femorotibial joints are formed by the corresponding medial and lateral condyles of both the femur and the tibia. And simply put, these just don't fit together very well. Remember, you have these relatively large femoral condyles that are sitting on these relatively flat tibial condyles. So mechanically, they just don't fit well, and that makes this joint relatively weak and very reliant on other structures for stability, like the tendons and ligaments. Let's walk through the movements at the knee joint. The main movement is simply flexion and extension. But due to the embryologic rotation of the lower limb, it is important to note that flexion of the knee joint actually occurs in the posterior direction, which is a big change from what happens in the more proximal joints in both the hip as well as those in the upper limb. So what does this modified mean when we're talking about a modified hinge joint? Well, it is talking about how there is a little bit of gliding and very slight rotation that is allowed at this joint beyond the typical hinge motions. So you may hear this terminology when discussing the knee, that the knee locks in and it unlocks. So locking is actually medial rotation of those femoral condyles on the tibia. And this, in essence, locks in the knee joint during full knee extension with the foot on the ground, locks it in, it allows for the muscles in that region to relax some without losing stability, so not having to use as much energy. In order to unlock and to begin flexing the knee, you're going to have lateral rotation. So those femoral condyles will very slightly laterally rotate, and then you can begin the bigger actions at the hinge joint. So again, these rotation movements and gliding movements are very slight, but important in overall movement of the knee, as well as locomotion and stability in general. Now, as mentioned, much of the stability of the knee comes from muscles and ligaments. We will talk about muscles in another video, but let's spend some time on these very important ligaments. And there are very, very many ligaments in the knee. We're going to talk about a few, starting with the collateral ligaments, which are going to be located on the medial as well as the lateral side of the joint. On the lateral side, there will be the fibular collateral ligament or the lateral collateral ligament. So, and then you very often hear them abbreviated. In this case, it's either the FCL or the LCL. Clinically, it's often called the lateral collateral ligament, but the actual real anatomical name is the fibular collateral ligament. And this particular joint is actually completely separated from the joint capsule. You can see the space right here in this illustration. On the medial side, there is the tibial or the medial collateral ligament, or the TCL or MCL. This is actually a bit of a broader ligament. And importantly, this is going to be a capsular ligament. And with this, it actually has a very clinically relevant attachment to the medial meniscus. And we'll come back to that in a moment. Anteriorly, there is going to be a prominent ligament that serves as the primary means of protection of the anterior portion of the joint, because actually the articular capsule is incomplete anteriorly. So this patellar ligament is really serving that role of the anterior capsule. And the patellar ligament is actually just the distalmost portion of the quadriceps femoris tendon. It's that portion between the patella and the tibial tuberosity, and it is really serving to protect this region. You do have some of the tendons of the sides of the quadriceps also playing a role, but this patellar ligament's the one that I'll have you be assessed on. The intra-articular ligaments, or within the joint capsule, are the cruciate ligaments, one of the most commonly known types of ligaments in the body. And there's actually a reason why many people have heard of particularly the anterior cruciate ligament, or the ACL, because this ACL is inherently weak and it's a relatively commonly injured structure. When functioning properly, it helps to prevent anterior displacement of the tibia on the femur. The posterior cruciate ligament, or PCL, is a bit stronger. It helps to prevent posterior displacement of the tibia on the femur. And the cruciate ligaments will crisscross, as their names would suggest, in the center of the joint. Sitting on those flat tibial condyles are crescent-shaped fibrocartilaginous structures called menisci. And remember, the medial meniscus, and you don't see it very well here because it doesn't have the collateral ligaments, but that medial meniscus will have an attachment to the tibial collateral ligament. So again, knee joint injuries are common. The most common injuries are generally to the ligaments. So ligament sprains are common, particularly in individuals that participate in contact sports. And then you can have slight tearing or very catastrophic tearing in certain types of injuries. I kept talking about that attachment between the medial meniscus and the tibial collateral ligament. And that is because it is so clinically relevant because they are often damaged or injured together. And sometimes the ACL is damaged at the same time just because it is inherently weak in general. And when you have those three structures being damaged at one time, that is called the terrible or unhappy triad. All of these ligaments that I just discussed can be damaged individually. Particularly, as mentioned a few times, the ACL is a commonly damaged or injured ligament. The mechanism is fairly common, particularly for the ligaments that I've talked about here. You can have a foot planted, and then you can have a blow to the lateral side of the knee. Think about somebody tackling somebody from the side, and that force will transmit through the joint and start damaging those more medial structures. Additionally, think about excessive twisting at the knee joint. That makes sense that that could cause damage to the structures within the knee. In addition to injuries, disorders like osteoarthritis can certainly affect this area as well. So there's many things that can cause pain associated with the knee joint. All right, to the practice question. The anterior portion of the articular capsule of the knee joint is incomplete. Which ligament functions as the majority protection of the anterior knee? So first off, look and make sure all these answer choices are ligaments of the knee. Go ahead and read through them. What do you think? So yes, all of these ligaments that we have here are ligaments of the knee. So we can't cross any of those off just because of that. So which one of these is the main protection of the anterior knee? Well, the anterior cruciate ligament has anterior right in its name. So that's it, right? Well, no, it does help to prevent anterior displacement of the tibia on the femur, but it's too small and it's too intra-articular to protect that whole anterior knee. So we're not going with the anterior cruciate ligament. We can mark off the collateral ligaments. Those are going to be medial and lateral, not anterior. The posterior cruciate ligament is also intra-articular, like the anterior cruciate ligament, and it's posterior to boot, so that's not the correct answer either, leaving us with the patellar ligament, which is the correct answer. Excellent. Hopefully this all makes sense. Make sure that you're going through those learning objectives and answering in your own words, and I thank you so much for your time and attention.